Right. So, thank you, Dr. Rishi and Dr. Vikas Mittal for giving me this opportunity to be a part of this instruction course on DMEK. Um, so, as we know, Descemet's membrane endothelial keratoplasty is a very delicate surgery. It's a complex surgery, and it's just a 10 to 20 micron tissue that we are dealing with, and we need to be careful. And all the nuances and the skill sets need to be understood to give a successful outcome and to prevent the endothelial cell loss and the ultimate visual outcome. So dealing with this tissue, we should be very careful, and it is kind of sometimes difficult for a novice surgeon or even for those who are transitioning from DSEC to DMEK. So it could be that we practice on the tissue which is discarded, which is the human discarded eye bank tissue, but just before that, to develop the macro and the micro reflexes or the tactile stimuli to deal with different types of the dealings of the DM, it's better to practice on certain tools or models or props beforehand. So, based on the study, which tried to identify the key challenges while trying to learn DMEK surgery, DM donor preparation, DM graft insertion, and graft unfolding in the anterior chamber was found to be, these steps were found to be the most challenging ones. So, what can we do about it, and how do we begin right? So, an ideal model or a prop should mimic the feel of the real tissue in real time, and should give the feel of the surgery, the exact feel. It should be affordable and easy to set up. So, based on different steps of the surgery, we tried to devise certain models, and we've even published them. So, looking at the graft preparation, this is the model that we have described, and this is actually the humble onion peel model, or the onion that is seen in our kitchen. We can take a peel of it and then place it on the Teflon block, and then it peels exactly like the actual Descemet's membrane. It also stains like one. You can practice partial trephination, you can practice stamping, you can practice its scrolls, you can practice how to punch it and then place it upside down and then peel it off completely. And this is how you develop the reflexes based upon the onion tissue. So you dry the well, and then you can even stamp it with the preferred letter P, F, S, L, whatever you prefer, and that is going to give you the exact feel of the tissue. After you're done with that, we can even prepare a scroll, inject it into the inserter, and place it into the practice eye tissue or the artificial plastic models that are available mounted onto the anterior chamber, artificial anterior chambers that are present, and can also practice the various maneuvers to open it. That's the thing that I was talking about. Right. So the next step is understanding the orientation of the DM graft inside the injector, and for that we have devised this large bore glass syringe with a bevel, and for that a plastic sheet with a printed endothelium on one side and a P marked on the stromal side gives us the orientation of how the graft should be placed. And if we insert the DM graft with the bevel up, this is the orientation which is seen, and the stromal side is seen in the correct orientation, and the graft opens in its proper place, and the P is seen the way it should be. And if we inject it with the bevel up, this is the way that the endothelial side will be seen, and we need to then understand that we need to invert the tissue. Inside the anterior chamber, there is fluid, and the DM is a very thin, delicate membrane, so we need to understand how to manipulate it, and which is very different than the tissue manipulations with Descemet's stripping endothelial keratoplasty or the DSEC. So we've published a DMEK aquarium, and this is made by using a transparent plastic balloon, and which is filled up with water and a plastic sheet or a scroll which mimics the DM graft, and that is how it's prepared. It's filled with water, then the scroll is pushed inside, and then it's sealed. with a rubber band. So that's a frugal use of that tissue, which you can get it from your laboratory shops. And then it even gives it mimics the handling of the tissue within the anterior chamber. These are waves that are created for crude centration of the graft using two cannulae, which can be mimicked by using two fingers to displace the graft to the desired side. You can also practice the unfolding of the graft, the pinning maneuver, as well as the inversion of the graft. This is another model which has been described, and this is the artificial anterior chamber over which we place the piece of a rubber latex glove and then prepare an anterior chamber mimicking the iris diaphragm, and all the practices of the dosa roll, the chapati roll, all unfolding and centration can be practiced in the discarded human tissue. So this is another wet lab model that we have devised. This will help us achieve desired outcome. So the suggested plan for surgeons starting to learn DMEK is what we suggest is watch videos as much as possible, as has been already described by Dr. Rishi. Then try on the onion peel model, try the DMEK aquarium, get the skill set of dealing with the DM nuances in the anterior chamber. Use discarded human eye bank tissues and practice on the surgical wet lab for a few cases, and then ultimately perform the first few cases preferably under the supervision of a skilled mentor, or one may even record your surgeries and then discuss with a person with an experienced DMEK surgeon. So these are a few of our wet labs that we had conducted a workshop in for DMEK at various places, and these are the tissues that the trainees had worked upon. The main ingredient for a good wet lab is an enthusiastic mentor who is ready to keenly observe what you're doing and is ready to share his knowledge with you. And the satisfaction that we achieve after imparting the knowledge to this trainee is evident with both the smiles of the mentor as well as the mentee. So we even do post-wet lab or post-workshop questionnaires which tell us that 85 to 86% of our trainees were very happy and confident to start with the actual DMEK surgery. And this is the final outcome of the workshop, wherein people post their first cases of DMEK, which they have managed to do on their own, and then they can even continue to discuss their troubles or their problems post-operatively. So that's the tools and tricks of the armamentarium for learning the DMEK surgery. Thank you so much. You're welcome, Rishi.
Thank you, Purvasha. I think you really beautifully covered the entire spectrum of wet lab practice, and I think it's very useful because people sometimes don't have access to corneal tissue. With your techniques, they can practice even without having access to an artificial anterior chamber or corneal tissue. You can just do these simple steps as long as you have a microscope. Onions are freely available, thankfully, even in times of drought. And I think this is a really good innovation by you and Vikas to try to use the onion peel as one of the layers, and you can practice everything how beautifully you've shown. So thank you.